Welcome to another easy nursing review. In this lesson, we will cover simple goiter. Before we begin, let's see if you can get this question correct. The nurse is giving an in-service on thyroid disorders. One of the attendees asks the nurse, "Why don't the people in the United States get goiters as often?" Which statement by the nurse is the best response? A. It is because of the screening techniques used in the United States. B. It is a genetic predisposition that is rare in North Americans. C. The medications available in the United States decrease goiters. D. Iodized salt helps prevent the development of goiters in the United States. Learn the answer at the end of this video. Now, let's begin by first learning what simple goiter is. It is when there is a lack of iodine in the patient's diet which causes the thyroid gland to become enlarged. This is seen less today because iodine is added to table salt. The thyroid gland can also become enlarged by ingesting large amounts of goitrogenic drugs or goitrogenic foods that decrease production of thyroxine, such as strawberries, cabbage, peanuts, peas, peaches, and spinach. This results in sporadic simple goiter. A simple goiter is not caused by inflammation or neoplasm. Now let's go over the signs and symptoms of the patient. Here are the following signs of symptoms. Difficulty in swallowing due to a large thyroid pressing on the esophagus. Enlarged thyroid gland. Respiratory distress from the large gland, causing pressure on the trachea. A tight feeling in the throat from a large gland. Coughing. Now, let's go over important labs and diagnostics. For a patient with simple goiter, there will be a decreased or normal serum T4 level caused by an underactive thyroid. Increased serum TSH by the pituitary gland, attempting to stimulate or shut off production of the thyroid in making thyroid hormone. RAIU uptake normal or increased. This test is completed with a radioactive isotope that is injected into a vein. A scan of the thyroid is done to visualize the thyroid more completely. Ultrasound, which enables sound waves to bounce off the gland, giving the size and location of any nodules. Now that we covered labs and diagnostics, let's now learn about medications used. If there is an increased TSH, administer hormone replacement with levothyroxine, desiccated thyroid, or liothyronine. If the thyroid gland is overactive, then administer small doses of Lugol's solution or potassium iodide solution. If the simple goiter cannot be reduced through medication, then a thyroidectomy is performed during which all or part of the thyroid is removed. All right, now let's move on to nursing actions. The nursing actions include the following. Avoid goitrogenic foods or drugs in sporadic goiter, since they make thyroid hormone production. Use iodized salt to prevent and treat endemic goiter, since the thyroid needs iodine to make thyroid hormone. And with nursing action comes patient education. Help the patient understand the importance of the following: the need for lifelong thyroid replacement after thyroidectomy and radioactive iodine, the need for intermittent lab work to monitor the thyroid, having regular visits to the primary care practitioner to monitor the size of the thyroid gland. All right, well, you made it to the end of the video. Back to that question at the very beginning of the video. The nurse is giving an in-service on thyroid disorders. One of the attendees asks the nurse, "Why don't the people in the United States get goiters as often?" Which statement by the nurse is the best response? A. It is because of the screening techniques used in the United States. B. It is a genetic predisposition that is rare in North American. C. The medications available in the United States decrease goiters. D. Iodized salt helps prevent the development of goiters in the United States. And the correct answer is D. Almost all of the iodine that enters the body is retained in the thyroid gland. A deficiency in iodine will cause the thyroid gland to work hard and enlarge, which is called a goiter. Goiters are commonly seen in geographical regions that have an iodine deficiency. Most table salt in the United States has iodine added. Well, that ends this lesson. Check out this useful video too.